Hi, my name is Drew Harding, and I present a case of critical airway obstruction following administration of radioactive iodine to a patient with retrosternal goitre. Our patient was a 65-year-old female who received a single dose of radioactive iodine to treat a toxic multinodular goitre without knowledge of a large retrosternal component. She subsequently presented to hospital 18 days following administration. She was unwell with a cough and fever and deteriorated quickly, requiring intubation and ventilation for hypoxic respiratory failure and upper airway obstruction. A difficult view on direct laryngoscopy was noted. A CT showed a large heterogeneous goitre extending down into the mediastinum with tracheal compression at more than one location. She was subsequently transferred to our centre 23 days after iodine administration. Thyroidectomy was postponed to allow for further clarification of the amount of retained radioactivity within the thyroid. Daily nuclear medicine review took place and found that levels were safe for routine nursing care. However, imaging with a gamma camera meant that surgery had to be delayed until 54 days following administration. A total bilateral retrosternal thyroidectomy was performed, and a tracheostomy was inserted postoperatively for ventilatory wean. This was subsequently decannulated 8 days postoperatively, and on review at 3 months in outpatients, our patient had made a complete recovery. There are contradictory reports of radioactive iodine use in retrosternal goitre. Clinicians should be alert to the possibility of airway compromise. Cross-sectional imaging should definitely be considered, and review by an airway specialist could also be pertinent. Alternative options for management should also be looked at. Our patient had a favourable outcome due to management in a tertiary centre with advanced airway, critical care, surgical and nuclear medicine teams, and this also ensured a safe working environment for staff.